Can a urine test detect chlamydia? Imagine going in for a simple test that could reveal if you have chlamydia without the discomfort of a swab. The good news is that urine tests can indeed detect chlamydia effectively. These tests use a method called nucleic acid amplification testing, or NAATs, which are the most sensitive and accurate tests available today. NAATs work by identifying the genetic material of the bacteria that causes chlamydia, called Chlamydia trachomatis, directly from urine samples. This makes testing less invasive and more comfortable for many people, encouraging more individuals to get screened. When it comes to accuracy, urine NAATs are highly reliable. They usually have a specificity of over 95%, meaning they are very good at correctly identifying those who do not have the infection. Sensitivity, which measures how well the test detects those who do have it, ranges from about 80% to over 90%. This means that most infections will be caught, but there is a small chance of false negatives, especially if the infection is in areas not well sampled by urine. For men, urine testing with NAATs is especially effective. It often matches or even surpasses the accuracy of urethral swabs. In women, urine tests are still very good but may be slightly less sensitive than vaginal or endocervical swabs. Vaginal swabs tend to have a sensitivity of around 94%, while urine samples usually show sensitivity between 87 and 90%. Despite this, urine testing remains a practical and reliable screening method for women, especially when swabs are not feasible. The way the sample is collected matters. First void urine, which is the initial part of the urine stream, is preferred because it contains the highest concentration of bacteria shed from the urethra. Midstream urine samples can also be used and have shown high correlation with first void samples, giving some flexibility in collection without sacrificing much accuracy. Clinically, urine testing is widely recommended because it is non-invasive, quick, and effective. It is especially useful for screening men and in settings where collecting swabs might be difficult or uncomfortable. For women, vaginal swabs are often considered slightly more sensitive, but urine tests are still a good alternative, especially for routine screening. It is important to remember that no test is perfect. False negatives can happen, particularly if the infection is located in areas like the rectum or throat, which urine tests might not detect well. In cases where there are symptoms or risk factors for infections in other sites, additional testing might be needed. In summary, urine tests using NAATs are a highly effective way to detect chlamydia. They are non-invasive, accurate, and convenient, making them a popular choice for screening. While vaginal swabs might offer a slight edge in sensitivity for women, urine testing remains a reliable and accessible option for many. Always consult with a healthcare professional for proper testing and interpretation of results, and remember that regular screening is key to maintaining sexual health.